My name is Ashanda St. I'm from New York City. I'm the child of Marba and Elbert Phillips. My mother's family is from the Dominican Republic, and we're immigrants here. And my father's family is from Alabama, and he is African American. And I'm one of 6 children, and I think my parents put all of their hopes and their dreams and their desires into their children, and kind of placing that focus on their education and allowing us to succeed, and kind of, lean on the shoulders of our ancestors to accomplish great deeds. And so that, we have a lot of responsibility to kind of change the world. And that's what I'm trying to do.
So what do you do?
I'm an OBGYN. Okay. I thought you wanted the philosophical answer,
No,
but yeah.
So yes,
I am an OBGYN. I have been a doctor for 22 years. I trained in Connecticut at Yale New Haven and Danbury Hospital. And after my 4-year residency in OBGYN, I was in private practice for a year. And then I came back to the inner city of New York. I worked at Jamaica Hospital for 3 years. And then I was at Columbia for 14 years.
So I met you.
So how did you get into, or how did you know that this is the field that you wanted to look into? Like, was it something that when you was young, you got like the toys that had like the doctor stuff, and then you was playing doctor? Like, where this drive came from to like, you know what, this is actually something I want to do and like help people?
Yeah. Well, it's kind of several different components. It's layered like an onion. And so I would say in the beginning, being the descendant of immigrants, one of the things that my grandparents sought here in America was kind of a higher education, and that they couldn't achieve in the Dominican Republic. My grandfather went to school up until the 6th grade, and that was it. They arrived here on Ellis Island. And so I think for them, it was just to aspire into kind of a higher level of education that they couldn't attain on a small island. So, when I was younger, my grandmother would always ask, I have 3 other female cousins, first cousins, who are all the same age. And she would say, what do you want to be when you grow up? And they all said that they wanted to be nurses. And so then I said, well, I'll be a doctor because I'll tell you what to do. And so it kind of rose from that. But I was always very advanced in math and science in school. Actually, I went to boarding school. So I went to public school here in New York City for elementary and junior high school. And then I received a scholarship to go to boarding school in Massachusetts. And while there, I think my first year there, so I was already advanced in math and science classes, and in Spanish as well because of my grandfather. And I was told by a guidance counselor that I should seek to be a doctor because I was good in math and science. So like he kind of, and it's actually, as I look back to it, it's really kind of narrowing my dreams, because like he basically told me that was all I was good at. And so this is the only thing you could be. But I think from there, that's where the passion arose. And at the time, my brother was going to Johns Hopkins, and he was undergrad, and he was applying to medical school, and he was taking the MCATs, and he was going through the all of the interviews and the stress, and it just so happened that I found out I was going to be skipped in high school. So I only went to high school for 3 years.
Dang, you were smart.
And so I was visiting. So what happens in prep schools at that time was we went to school 6 days a week. And so like whenever there was like a holiday, like Thanksgiving, instead of having 2 days off like public schools, we had 2 weeks off because we went to school on Saturdays. So like when you were home for Christmas break, you would have a month off from school. So I was home, and this is when again, I'm dating myself, but they were having a college fair at the Felt Forum. That was the smaller arena in Madison Square Garden.
Okay.
And my mom was just like, you need to go there and look at colleges. And at that time, I really was just looking at Princeton and Yale. And I went to this college this college fair, and they had something about the Sophie Davis program. And so the Sophie Davis program is a program at City College in Harlem, New York. And it was a program that was started for Blacks and Hispanics to become primary care physicians to work in medically underserved areas here in New York. And it was started in 1973. And so I was just like, wow, I was fascinated by this because I was just like, oh, wow, this is a program for minorities. I was like, this would be great. And actually, the curriculum was dedicated to kind of like learning medical Spanish and kind of cultural sensitivity and all those things. And so I was just like, wow, this is exactly what I want to do. The difference is that so it was a 7-year BSMD program. So you actually do college and medical school in 7 years instead of 8. Damn. In addition to that,
and you finished high school early,
so you good because you ain't got skipped a grade, so you good. You can do it.
You could have done the 8.
So literally,
you finished it in 6.
This is what I wanted to do. No. So this is what I wanted to do, and I was just like, wow, I can do this, and I don't have to graduate with all the loans that my brother owes. So yeah, this is what I want to do. So when I returned back to my boarding school, and I was like, look, I want to apply to this program at City College in New York. They were like, what? Are you crazy? And so they literally thought I was like absolutely like bonkers, and they called my mother up, and she's thinking these crazy things, and she wants to go to City College. Like, she's getting into Princeton, and she wants to go to City College. And so, but my mother understood it, and my mother actually graduated from Queens College, so she felt that education is just as good. And so when I graduated from boarding school, and I started City College at 16 years old in 1990.
Wow.
And so when I started, again, this is before now.
You're like Doogie Howser, right? Like right? Doogie Howser. Even though he's on television, but he started when he was 13.
Yeah. Mm-hmm. So cool. I started City College, and am I muted?
No.
Oh, okay. I started meeting I started, and I thought I wanted to be a pediatrician because being one of 6 kids, I love children. And I was just like, okay, this is what I'm going to be. And so you stay at City for 5 years, and then you enter your 3rd year of medical school, which is already your clinical rotations. And the disadvantage of that is that you're then joining a school that, with students who have already been together for 2 years. And you don't know them. And what happens is that, a lot of these schools, there's no minorities. So when I joined my medical school, it was 6 of us that came from Sophie Davis, and we were all, Black and Hispanic. And we joined 200 people that were all Caucasian. Okay. And so that was challenging and different, because then we had to prove that we were smart enough and we deserved to be there. And
how were you able, sorry to cut you off, because that's a great thing. Like, because I feel like, being a person of color, you always got to work not even twice as hard, like 100 times harder than, the person of a white skin color. And they always say, oh no, that white privilege is not a thing, but it is, and that's what it was built on. Society. It's just a fact. So how challenging was that for you to not even prove to them, but like prove to yourself that like I'm capable? Just because you're automatically judging me of my color, skin color, that has nothing to do with what my brains and the gifts that I have to actually pull through and do this.
Yeah. Well, I think I have to say I give all of that to my parents. My parents were very, very proud people. And so we were taught to be very proud. I mean, again, my father specifically gave us all different types of names. My name is Ashanda. And so it was very much kind of part of our raising to be very, very confident in our skills and let us know that no one else was better. I mean, we were always in athletics. So I played tennis from the time I was like 6 years old. So you kind of, athleticism and that competitiveness kind of builds your confidence. Yeah. And so that discipline, absolutely, the discipline and the confidence. And so, and it's done with humility. It doesn't, because that's what sportsmanship is. It's right. So it's not, I have to have this conceitedness and I'm better than you, but I'm just as good as you. And so I think, I'll never forget when I first started my first year of residency, I'm at Yale. And again, I'm the only person that looks like me.
Yep.
Okay. And, I look different. I think I've shared pictures of me, but when my hair was straight and black, many people didn't really know what my ethnicity was. Are you black? Are you Chinese? Are you, I'm telling you, are you Filipino? I mean, I had one time at the Allen, a patient said, I need to speak to the Hawaiian doctor who speaks Spanish. And I was like, and if you could imagine, we had a Hawaiian doctor who used to get angry because she was like, Ashanda's not Hawaiian. So I think, I think, and, you have to understand, coming from my grandfather, my mother's father, who was Dominican, who just looked like a regular Dominican person, whereas my grandmother, like, she looked very Caucasian, green eyes, straight hair, you know what I mean? And so, and I had people like that who told me, listen, you are the best, you are the prettiest, you're the good enough, your hair is fine. You know what I mean? And so I was told that, and I really felt that with my family. So, like, I mean, and like, I walk into the clinic like I own it because, that's just.
And you do, boo. We will VIP.
But, you always keep your head up.
Yeah,
always keep your
definitely.
head up, and you never put your head down. You are always good enough. You are always worthy. Yeah. And I think that.
You was one of the best Hawaiian doctors I met.
Yeah.
So.
No, but not only are you confident and loving, but you're so humble and caring. Like, you're the best doctor I've ever had. I'm going to start crying because you are. You are. And I want to thank you for that.
You have to understand, my mother had 6 children. And all of them, she went through the clinic. And so one of the things that she taught me was that, one of the things, that's why I wanted to be in Upper Manhattan, because all of the patients could be my mother. They could be my grandmother. They could be my aunts, my cousins. My cousins live on 137th Street. You know what I mean? I have cousins who still don't speak English. It's just how it is, my mother was born at New York Presbyterian. So, this is, so my whole thing was, it was a calling. This was something specifically where I was giving back to my mother and everyone that came from there, and so that's why it was so important to me. And one of the things my mother always said to me is that just because someone is in a clinic, they're still a person. And how would you like someone to treat me? So to me, like, every patient was a private patient. And so when I took over, like, Charles Rangel, and then when I took over all the clinics, it was just like, these are all little private practices. I want all the patients to get, top tier treatment. You understand? Because that's human treatment. We all want to be treated like humans, and if we look at it, the race as the human race, not ethnicities and you're black, you're this, you're that, you know what I mean? Guess what? We all bleed blood. It's red. Exactly. You know what I mean? So it's just, I think, again, I have to give everything to my parents and my grandparents. I mean, they were everything. Those were the giants that I learned from. And I mean, again, my father, my mother completed college. My father, he got his associate's degree, and he did manual labor. And he told all of us every day when we were growing up, I work hard every day with my hands so that you guys will only work hard with your brains. And that's what we were taught every day. And so, and we were told all the time, we're the hope and the dream of the slave. You know how many people sacrifice, you know what I mean? My grandmother came from an island. So back then, so my grandma's people are from the British Virgin Islands. So that's Tortola, Virgin Gorda, and Anegada. Anegada is 5 square miles. There's no agriculture because it's on, I can't even think of the word right now, but, so there's no agriculture. So like coming to this country, being able to have fresh fruits, she had to go to DR to get to America because remember, they only immigrated a certain amount of people from these small islands. So you went to a bigger island so that you would get a better chance of getting a visa so you can come here. So, again, I heard these stories every day. So I appreciated everything that I got, you know what I mean? But also I was able to recognize when I was at a place where I could help people, that you help them with everything you have. Right. You understand? Because someone helped my mother, helped my grandmother, helped my cousins, And so that's kind of what, these were like principles that I was taught from a young age. And it was instilled, like it was almost beat over you over and over and over. but I'm glad they did it because, you know, I understood what my purpose was and what my calling was. And, you know, I have an opportunity to change someone's life with an interaction that can make them have a positive experience from medicine because not everyone has a positive experience in medicine.
Yeah.
Not
Oh,
at
no.
all.
Yeah, especially
I
nowadays
can vouch
too.
for that as one of your patients.
Yeah.
Totally. I'm serious.
Yeah, it was
This
so
is my
funny.
patient who I spoke to all the time and never told me she was an actress. Okay?
Yeah, because we didn't talk about that. We had to talk about my issues.
I mean, I still to this day, I don't
told
really
her
like
after the fact.
I
After
really
I had
don't
the
like
baby.
doctors, but meeting you was like
Oh my
a
God.
breath of fresh air. But like, I grew up with was a child doctor, and the moment that like I turned to adult and I had to get like I guess adult doctor, like it was like day and
You
night.
stop seeing your pediatrician.
Yeah, I stopped seeing my like I saw him until like he was like, I can't see you. You're like in your 20s now. You have to leave. I was like, come on, man. Like you know, since I was a baby, you can't just leave me. But when I had to get like a regular adult doctor, it was like day and night. And what I mean by that is like they didn't care. Like they just went through the books or the basics, and they try to scare you, and they don't warm you up with information. And then I remember I told my brother, I was like, "Yo, I don't like this doctor." It was like, "Well, they're all like that." I'm like, "But then I don't want to. I don't want to keep going back. Then, like, it's a nightmare. It's scary." So, but meeting you, it's like this shows that like there's different types of doctors that actually has a warmness to them. They also treat you like an adult and also a human being. And yes, I have all this information and wisdom, but I'm gonna break it down to you so you can get it as well. That's not going to be something that's going to hinder you from coming back and do these checks and stuff like that. And that's what something that I appreciate when I met you. I was like, oh man, she's great. She's wonderful.
No, and like when I met you, we had that conversation. And like, I think you were thinking about something, and they were telling you. You had shared with me like they were telling you, oh, you can just do papers right now. You don't have to see patients. And you were like, what? When you told me that, you were like, no, I'm gonna see patients. That's my passion. And we had that deep conversation, and that's when like the first time I really got to know, like, wow, you're really doing this because you care and you have a passion, you have a good heart, and like that really touched me because I saw that from you from the day I met you. But that even more when you shared that with me, I was just like, wow.
Were you
amazing.
like that growing up, like being like? In a sense, because I feel like that being the doctor who you're as a reflection of who you are as a human being, just naturally, like being caring.
But look at her family, how
right. But you know what I'm saying. But there's people that can like fake the funk and be like,
True.
have the job and like pretending like they care about you, and then they leave like, oh my god, thank God this person.
Well, there's some patients
but
that are
I would assume that you was like that. Like in your whole life with other people, like friends, family,
okay.
You know what I'm saying? Being that warm person and treating everyone like a human being. Was that like that in your childhood or, growing up in interactions with other people?
Well, I could tell you this. When I was in medical school or when I graduated, my parents didn't care. They were like, mop the floor, wash the dishes. Okay. We don't care. Good luck. Okay. But this is what you're going to do. But I think a lot of it comes from my personal interactions with doctors. I felt they were horrible. They didn't care. They didn't look me in the eye. They didn't speak to me. They're looking at the time. You got 10 minutes or, so I never had, I don't think I ever had a positive interaction with doctors. As I got older and I became a doctor, then I kind of dictated how they were going to treat me because I let them know that I was a doctor. Nice. But, but why should you have to do that?
Exactly.
So I didn't want my patients to have that type of interaction. You understand? And so I think a lot of how I kind of molded the way I practice medicine is all the things that I didn't get. And then I guess for my family and for my friends, you know how we used to call it the hookup. Somebody works at the Gap, I'm going to get a hookup. So, like I was like the inside person for medicine,
Gotcha.
Like I could explain things to them. Maybe the doctor didn't explain, they may need that prescription.
Yeah.
You know what I mean? It's the weekend, or stuff like that. Like even in my family now, my brother is a family medicine doctor, but they come, and I'm an OB, but everybody comes to me for everything. Neurology, orthopedics, thyroid. They all come. But because they know I'll spend the time, I'll look over it. They're like, Sean, I'm gonna just fax you some stuff. I'm gonna text it to you. Take a look at it. Let me know. And I'm like, okay, But
girl, I'm gonna come to your house, just get an X-ray real quick. I'm gonna go to the basement. My foot hurting.
Talk to you about my back pain.
Listen, I had a cousin of mine when I lived in my apartment. She was just like, "Can you just deliver my baby at your house?" I was like, "I have white carpet. How could I do that?"
I remember you told me you had white carpet.
That is hilarious.
But I think I just wanted to be the person that I never had. And so when you see how you change someone's life, and the thing about it, when you're pregnant, you start seeing the doctor every week at one point. It's a very close relationship.
Yep.
And I think that also kind of as we have the internet and people get more educated about childbirth, they decide kind of what kind of labor and childbirth experience they want. And I think that there's that intimacy between your provider that if you don't have, it can impact on how your delivery is.
Yep.
And that could be traumatizing. Yes. And the way that I always have said, this should be the best day of your life.
Mm-hmm. And there's a statistic that I know about that they were saying that there's more black babies, there's a higher percentage of black babies deaf when they're like delivered by someone. I'm not trying to put down the white man, but I'm just saying if there's a higher percentage of
black
children of color dying by the hands of white professionals around rather than black professionals, people of color. And I just saw that and I was like, let me look into this because I'm like, you can't believe all the memes, but it's a true statistic. And I'm like, what?
Yeah. Oh, wow. So what it was on CNN. It was posted last week. So it says that black infants have a higher chance of survival if cared for by black providers. And so, as we look at New York and the racial disparities that exist, so I do a lot of work with the Department of Health in terms of racial disparities and how we can impact maternal health, especially for women of color. And so this is kind of incorporate, and again, there's a lot of traditional medicine providers, and I say those are physicians who don't welcome midwifery and doulas and kind of holistic approaches. But I think that when we look at Black women are 12 times more likely to die of childbirth in New York City, okay? And that's horrendous, okay? Because we're one of the most advanced medical technologies in the world, but Black women are dying. And so then you have to think that there must be a component of racism that exists in the medical system, and I think that also implicit bias. And so when we kind of have these conversations, we need to really have strong conversations about implicit bias training, cultural sensitivity training, but also kind of looking that right now this approach isn't working. So let's talk about holistic approaches. Let's invite midwifery medicine to the conversation. Let's talk about doulas because, again, people of color don't feel that they're heard and they don't feel that they get respectful care. And so that's my work with the DOH. And this is stuff I've been doing for a while. I'm working on an equity steering committee to kind of address this these horrific numbers here in New York City because it's unacceptable. It's unacceptable.
Yeah. Oh, wow. How do you deal? I know working with hospitals, there's a lot of red tape and it goes against what your morals, your values, what you believe in. How do you keep true to what you believe, true to yourself, despite the people above you saying, oh, do this, do that? How do you deal with that challenge and how do you continue to be your true self? Despite that,
I think you have to be strategic. I may not win every battle, but I'm going to win the war. And so I think I kind of hold true to what would I want done for me, my mother, my cousin, my sister, my cousin, even if they're not related to me, and so those are kind of the things that I think about in terms of creating models of medicine that are more holistic and kind of community based and also kind of rooted in grassroots. So, again, it's not your traditional medicine, but guess what? That's not working. It's not working. And a lot of people don't trust, medicine. I mean, and
Right.
rightfully so. If we talk about, the Tuskegee experiment, if we talk about the Mississippi appendectomies, if we talk
Mhm.
about Marion Sims, I mean, we have several examples where people of color don't trust medicine.
Mhm.
So when my patients, are distrustful, I get it.
Yeah.
Yeah.
I understand. Listen, I've had negative interactions with physicians on multiple times. And I even had it, when my father was alive. I had to come in every time and tell them I was a doctor.
Mhm.
And, my father is like, oh, and I said, Daddy, no, that makes you bulletproof because now they're
Mhm.
scared.
Yeah.
And I would always tell them, I said, I'm the hurricane. If my brother comes, he's the tsunami.
Mhm.
Don't want it.
I don't like how sometimes they don't even like factor herbal medicine as something that's like just as effective as taking a pill. I'm not saying it's going to solve everything, but
It's going to help in some
I feel like
ways,
it's going to help in some ways because it does come from the earth, and we are, we come from that. And I just feel like I just don't like how they just brush that off sometimes, why it's not even an option. And they're just quick to put you on a pill, and that's it. And I think it's like the rest is just finding out. Let's see what this pill does, because and then we'll take you off or whatever, and then we'll go to another pill. Like that's how some doctors just are. They're quick to just throw you in something.
I think some of the skepticism arises from the lack of education on the kind of the medical education on the medical school level.
Mhm.
But I think also is that there must be a recognition that some of medicine is sponsored by the pharmaceutical industry. So it
Definitely.
impacts them when they prescribe your medicine.
Yeah.
Definitely.
There's a very telling documentary on Netflix called, what is it? Oh gosh, I can't think of the name, about kind of diabetes prevention and how there was a man who, oh gosh, I can't, it'll come to me
Okay.
because
Okay.
it's what made my husband become a vegetarian. But
Mhm.
it's basically a man who basically
I was thinking about that a couple times.
Yeah.
The veggie life.
Yeah, you have to watch this documentary. And so basically what happens is that he was diagnosed as pre-diabetic. And so then he went on the Diabetes Association website to kind of learn how to prevent diabetes, but he learned that there was no prevention. There was only treatment because they don't want to prevent it because
Right.
that site
It's
is
money.
actually supported by the pharmaceutical companies. So I think that when you speak to kind of different doctors, I think for me personally, you have to incorporate a holistic approach. And you have to have you can't have a general approach, but a patient focused and a patient centered approach.
Mhm.
And so it has to be customized with
Mhm.
each patient in mind
Exactly.
because,
Right.
one size doesn't fit all.
Right. And like from my knowledge from that, like I know there's different layers to diabetes, but I feel like when it's just spoken about it's almost like from the
They just
general
put it in
doctors,
one-
they just put it.
one
They just say
category.
you have it, you can't beat it,
Yeah.
and
Right.
and here's a pill, and that's it.
Yeah.
But then I hear a lot of stories, even like my cousin, where he had it, and then he did beat it, but he changed his lifestyle.
Yeah. Yeah.
That's from the eating and all stuff, and
Mhm.
and then he got off it, the medication, and the doctor's like, good. And I liked his doctor because he's like, okay, this is what we're gonna do to get you off the medication slowly. It wasn't like a death sentence. It's like, well, for the rest of your life, here's some pills and that's it. But he told him, if you want to change, you're gonna have to change your lifestyle and make a lot of different commitments.
Well, he had a good doctor too.
Right.
Seems
But
like.
I feel like when you hear just diabetes or anything, it's
Yeah,
just
it's
like,
just like
all right, well, here's a pill. Or high
pill or
cholesterol, here's a pill.
injection or-
Or high blood pressure, here's a pill. That's it. And it's just not curing it, it's just treating it. And also could be damaging other things and giving you other things as well. But that's just like, that comes with the territory of just medicine, period, I feel.
Yeah, but I think that, that's where the change has to begin.
Mm.
Because again, you need a more holistic approach because it's not working.
Yeah.
We have such obesity in this country.
Mhm.
And so you say to yourself, wow, there's so much fast food. There's no home preparation of food. These foods are preserved with a lot of salt and a lot of kind of additives and preservatives. And what is it? Corn syrup and all sorts of
corn
yeah,
based
yeah,
soy.
yeah.
Yeah.
And
We
these
saw
things,
documentaries on that, and like just the
Yeah.
food alone gives you all these illnesses.
Yeah. And so why are they selling us and feeding us this?
Mhm.
And so then you have
They
to
want
think
us
about
to die.
or
No, they
get
want
the drugs.
Yeah,
get the drugs.
exactly.
That,
They
you
want
know,
you to live just
that-
enough till they get
to
their
get the
paycheck.
drugs so that they could get the paycheck.
Yeah, and so I think this is what this is what's ailing medicine now, and I think these are ways that we need these efforts to kind of
Mm.
change. One of the things we were doing in one of our clinics was when we identified food insecurity, we were able to give green dollars so our patients can go to the farmers market instead of just buying fast
Wow.
food, or
Oh,
this way they can prepare their foods, and then also kind of having, and this is before COVID, having the mobile food pantries arrive at the clinics so that when we identify that you have food insecurity, that you're able to get food, because that's what you need, really, And so, I mean, and again, kind of putting a more of a spotlight on nutrition, healthy eating.
Exercise.
Years ago when I was in high school, junior high school here in New York City, we had a food class, a cooking class, You don't have that anymore. So
Nope.
people don't know how to cook food. They know how to go buy Chinese food, but they don't know how to cook. And that's a dying art, because as we go from generation to generation, we're not really cooking as much because everything is the fast living. And that's what, COVID kind of did, was let people slow down, stay at home.
Order.
Yeah. So
How was it delivering the experience of delivering your first baby? Like, was it like super nerve-wracking? Because I imagine you watched videos, you studied, you do those, but there's nothing like actually doing it. So
and how you chose to be OB, because you wanted to be a ped. That's
so
right.
I wanted to be a pediatrician, and my first rotation. Okay, so my first rotation, when you started doing your clinical years in your third year of medical school, my first rotation was psych. And I guess for me, I wanted to be a doctor so bad for so long. Like every rotation I went into, I was like, I want to be this. So, I go into psych. I was like, I want to be a psychiatrist. And my second rotation was OB. And I'll never forget the first day, this is at Metropolitan Hospital. And this is in 95, 96. And, I put on scrubs. I wasn't even 5 minutes into scrubs. They're like, go in this room. And I see a baby being born. I was like, and then I called my mother. I was like, you did this 6 times? What's wrong? I was like, what is going on? And, I really never gave OB a thought. And I just loved it. I just thought it was amazing. I remember the first time I saw a C-section. And during the procedure, often you can take the uterus out. And so me and the other students are looking behind and we're like, oh my God, you see that tumor? Oh man, this turned into an encase. And I mean, because we don't know anything,
Yeah.
So you're seeing this and you're just like, wow. And to me, it was just the amazement of that baby was inside her stomach and now that's alive. Like nobody can explain that. Nobody. Listen, it's just so impactful. And so for me, I love the medicine. I love the surgery. I love the OB. I love the outpatient, having that relationship with your patient. Number one, that it's mostly a healthy population. So it's mostly good news. 90% of the time. And then just to be part of the miracle, I was just like, this is awesome. And I never thought I was going to like it, because back in those days, this is before the regulatory hours laws. You worked over 100 hours a week and, that's what it was. You were tired. So what? Yeah. And, as a medical student, like we were just like, get this, do this, And I just, the last day of the rotation, when it was over, I cried when I left the hospital. And I was like, oh man, I'm in for it. Because I knew, I was like, oh man. And every rotation I did after, I was like, and the only other rotation that I enjoyed was surgery. But as a woman of color back at that time, there was no way I could endure 5 years of that. They were so racist, so sexist, that I was just like, there's no way I would survive this. Yeah. And I still wanted to be a surgeon. So then I was just like, well, I guess it's OB. I did pediatrics. I did that at Lincoln Hospital in the Bronx. Okay. And it was so incredibly sad. I can't see children sick. Yeah. I guess you don't realize that part. And, they're in these like metal cages in the hospital and they're either having asthma attacks. In there, the most of is asthma and sickle cell. And it just was too sad for me. I'm like
Yeah.
crying, you know, talking to the parents, and they're like,
Yeah.
okay, could you get it together? And I'm like, I can't stop, you know. So, you know, I realized that wasn't for me.
No.
And so that's how I chose OB. And I remember the first baby I delivered. So it was when I was a medical student, and I was just like, I just couldn't believe I was a part of that. I couldn't believe I did it. And I can tell you, in my career of 22 years so far, I stopped counting after 5,000 babies.
Wow.
But I can tell you, every time
5,000.
it's so amazing to me. You know, because you just, it's just that wasn't there.
I remember you told us that when you,
Mm-hmm.
It's like the first time.
Yeah, I mean, it's each time it's just incredible. Like, it's just, you know, and to be part of that experience for somebody, because they always remember the day they give birth, you know? And so you have an opportunity to have an impact that's, you know, life lasting.
Yeah. How do you remain calm in hectic situations? And like, I feel like that's something like not taught, you know,
you're calm and tough,
right? You know what I'm saying? Like in those situations, you could just fucking like, all right, we need this, we need that, hurry up, like, you know. But like in those situations, it's not making like the situation better, because you could seeing your doctor freak out, you're like, oh shit, this is not good. But I could imagine, I don't know if that's a lesson or in a class, but like, how do you remain calm in situations and keep composure where things could be going south, but you got to do your best to like whatever it is to make it good?
I think that's how they weed out who can do it and who can't in residency. Okay. Because I think that the people who kind of you know, panic, you know, this is probably not, you know, it's not the, you know, I think it's not the field for you. But I think also it's experience. I can tell you this. So when I trained in Connecticut, you know, it was mostly healthy, thin white women. And our biggest fear was redheads because they bled. You know, that's it. I mean, I could deal with anything else, but if she was redhead, I was like, type and cross 4 units, you know? And so, no, this really is. I was like, she's gonna bleed, be ready, she's gonna bleed. And no, that was it. And then what happened is that then I came back to the inner city and I worked at Jamaica Hospital. And let me tell you, I saw every and anything. And I think, you know, it was very good for me because, but very stressful. So again, I think, you know, we all are of the, you know, kind of belief you never let them see you sweat. Yeah. And I think that if your patient sees you panic, then they're going to panic. Yeah. And I think that there has to be a captain of the ship. And, you know, like I remember one time when I was working at Jamaica, and again, I look young. People think I'm younger than what I am. They think I have less experience what I have. And so there was this doctor who was like he wasn't even an attending physician here in the States. He came from Romania. I guess he couldn't pass the exam. So he was like kind of like a glorified medical student. So like we're in surgery and he's like trying to tell me what to do. And I was like, listen, buddy, there's one captain of this ship and I'm actually sending you overboard so you can leave. And he was like,
oh, very tough Hawaiian doctor.
And he really was just like, he was shocked. And I was like, no, I need you to understand, I can finish this without you. I don't need you. So you can go. And he just looked at me and I was just like, does anyone else want to leave? And I was like, otherwise I need silence. Okay.
Nice.
And so I think you just have to, so sometimes again, it's not, you know, so you need your confidence and your competence to match. Because you can't talk the talk if you can't walk the walk. Yeah. But I think what Jamaica did for me is I saw probably every possible complication. I mean, I could tell you on August 14th, 2003, we had a blackout here in New York.
Okay. Oh, I was actually was the most complicated thing. And
listen, and the generators didn't work at Jamaica Hospital.
Oh my.
So listen, I've seen any and everything. And so being at Jamaica, I only had to do 2 years there.
Wait, hold up.
Wait, what happened with that?
Go to that day. What happened that day? It's story time. Hold on.
So, do you remember the blackout?
Yeah, I remember the blackout. I didn't know you, but now you telling me you was working. What happened?
Year after you said 2002?
That was 2003. You was delivering a baby that day?
Yes, I remember.
August 14th.
I remember that day.
So you had like flashlights or something? Like to deliver the baby? Oh my. That's crazy.
Generator didn't come on for 2 hours.
So the heart,
Damn.
you couldn't even hear the baby's heartbeat, anything.
Oh my.
That was literally like back
And one
at
of my
the
friends,
campo. You know what I mean? Like literally in the country.
yeah, and one of my friends was actually about to perform a C-section.
Oh my. Damn. And everything ended up fine that day.
Like you delivery went fine, C-section
no,
went
she's like,
fine.
no. I'm not
Well,
gonna talk about it.
everything on my hand went fine.
Yeah. Damn. That's
Oh.
insane. Wow.
Yeah, so so I think the stress that I endured at Jamaica, I think it did several things. So it prepared me for any and all complications obstetrical that I would ever encounter.
Okay.
It developed kind of a strategic approach of complications in high risk cases because you were the only one, and it also enabled me to have a comfort level. So, one of the reasons why I left is, after 3 years, and, I made good money, but I said, I will have gray hair. I'll have wrinkles. I'll have hypertension and I'll have cardiac disease if I stay here. I would have to do yoga when I was on call because it was so stressful. It was so stressful. Like, imagine them calling you, like, from the ER, look, we have an ETA of an ambulance, 2 minutes. She's pregnant, she's bleeding, she's unconscious. We know nothing else about her.
Oh my God. Figure it out.
Yeah. But also, you don't know if she has allergies. You have to take her to surgery. Then you encounter other things. You're doing procedures that are going to save her life. I mean, it was a lot. But what it did was it gave me kind of that inner city experience that I didn't get at Yale. So then when I got to Columbia, listen, I was doing cartwheels and hopping through the hallways. I was like, you guys are worried about this. This is nothing,
Yeah.
So, like, they would always call me for disasters because I was like, listen, this is nothing. And, I think, again, it's just part of kind of developing your armamentarian and kind of being your exposure to kind of high risk cases. And so, like, even in the hospital that I'm at now, last weekend we had like 2 like really horrific cases in the emergency room, and I happened to be there and I was on call, and like they were like amazed at how the swiftness is how I carried it out. And like, and even the patient said the next day, she goes, she told me exactly what she wanted everyone to listen to her. Because there has to be kind of a commander, you know what I mean? Because that is gonna have everyone kind of not
organized.
be fearful. Yeah. Organized.
And how the commander works, you are at ease, you treat people with respect. So that's the way you lead is the way other people will follow it. You know what I mean?
And that's exactly it, because I have seen other people like just bark out orders, be completely disrespectful, and you could see the panic.
Yeah.
And, so
also people would hate to work with you.
Yeah.
And they will do a half-assed job.
Everyone who works with you, I noticed, like, everybody's comfortable, everybody's happy, everybody is respectful. Like, you just see the energy because of the energy you create. Everyone else, you see everybody else's energy. It's like, okay, they're on the same page.
I have been fortunate to at Columbia, and one of the things that kept me there for so long is to work with an amazing group of people who I have had the opportunity to call colleagues, but also friends. And this is from our housekeeper to our assistants, to our nurses, to our midwives. So I think for me, I was very fortunate and blessed to have that. And so it made work not work, if you understand what I'm saying.
Yeah.
So it's almost like we were hanging out, we were girlfriends, we were chatting, we were taking care of patients, and it made it quite a joy. And we were taking care of people that look like us, and so these could be our family, and so that made it easy. You know what I mean? But I think they also know that I value their experience. So when they're calling me about something, I'm going to take care of it, and they know it. They know it. They have no question about my judgment, as I don't of theirs. And so it's kind of a mutual respect. And I think that is kind of the best way to work. When you have this kind of person that's barking and yelling and, and then you have the cowboy it's too much.
Yeah.
It's too much. And there has to be some sort of peace and tranquility in childbirth, because that is what's going to calm your patient. You know what I mean? If you come in, it's too much,
What has been what you do brought you that you didn't know you had all this time? Like, what does that bring you?
Um, I think it brings me a sense of being and what my true purpose is. You know, I recognize and I'm very, very cognizant, and I recognize that I've been given this special, you know, as my mother says, put your healing hands on your patients. But I understand that it's bigger than me, and I get this from the Most High. And so I feel that I am just a servant of Him, and so that my job to at work is just to be an extension of what God's blessing is. And so that's the way I look at it.
Mm.
You know, I can tell you this, and I say this with a straight face. There are times that I've had emergencies. I don't know how I did it, and I know I didn't do it.
Yeah.
And that's why sometimes I tell patients, don't thank me,
Mm-hmm.
because there's only one person that saved you today.
Mm-hmm.
Okay. And so I think I'm very, very accepting of that. And I understand that this is just an extension of God's healing's hands and my purpose here.
Mm.
I think it's no mistake. I don't think anything happens randomly. I was supposed to meet you. I was supposed to deliver your baby.
Mm-hmm.
And I and I think that, you know, I think God doesn't make any mistakes. So I really kind of look at this as just a calling and my purpose here.
So we're gonna move forward to like our two last segments of the interview, and thank you for sharing so much. So the segment is called "Let's Look Inside," and there's 3 questions for that. And the first question is, "What do you love about yourself?"
Oh wow. In terms of my characteristics,
Whatever comes. This is not a medical test. Whatever comes. Whatever comes to you.
I love my ability to kind of give others of me. So give my time, give my compassion, my empathy, and I'm able to root that in all kind of my own experiences, good and bad, to see how I can make someone else's life better.
Nice.
The second question is, what does the American dream mean to you?
Well, I have to say, as you know, a descendant of immigrants from a small, you know, island in the Caribbean, it was the ability to kind of outlive my grandparents' dream of getting an education and attaining a profession, and also being able to help others as well as help your family, but also staying humble and understanding the importance of compassion and empathy, and that you're not better than others, and kind of that humility, but also understanding the perseverance that it takes to get there, but also knowing that it's on the strength of my forefathers and on the shoulders of my parents.
The last question is, if the average lifespan was 40 years old, how would you live your life differently?
I'm older than 40.
But if you knew it was just 40 years old, that's it. You're
like
done.
high school,
You're done. You're going back to the Lord's healing hands. 40 years old. How would you live your life differently? Like, was there something in there you would just take out? I'm like, maybe I should have did this faster or whatever.
Not.
Like, or maybe not. So, but yeah, how would you, if you knew it was 40 years old, how would you live your life differently?
Yeah, I probably would have partied more.
Yeah, that's a great question. Yeah, that's a great answer.
I mean, listen, my father put the fear of God into me, so I never had a sip of alcohol until I graduated medical school, because he told me that he would beat me in front of the class if I did anything. So so I think I would probably have had more of, you know,
social life.
Like, nice. For instance, my husband and I met 30 years ago in college. And he will tell you that
your father introduced him. This is a good guy. You better talk to him. Did your father introduce him to you?
No, I met him in college. I met him at City College. Yeah, right there, 137th and Convent.
Nice.
Yeah. That's why when we got married, we took our wedding pictures there on the campus.
Nice.
But yeah. And so he was Mr. Popular, and he'll tell you I was a nerd. And so I never went to one party while I was in college. Maybe I should have, I would have probably partied and but I think I was always taught that you pay now and you play later.
Yeah.
And so that's what I did. So I think that if I knew that I wouldn't make it past 40, I probably would have, see if I could spend more time with my grandparents before they died, before my nephew before he died, and before with my dad before he died. I would have changed those things.
Nice. Okay. And then the last thing that we got these like reflection cards. So we're gonna just shuffle them, and there's like one question in them, and whatever comes out, she'll ask you it.
So what irrational fears did you have as a child?
That I wasn't good enough.
That's a great one.
And what irrational fears do you have now? That's a good one.
I may not have the answer, or I may fail my patients.